happy to be here. I want to thank the organizers for the opportunity to share my insights and the insights of the group that I work for in terms of hygienic design, sanitary design, and what's the significance of that for the food industry. The company that I work for was founded by Dr. David Acheson, who was the Associate Commissioner for Foods with the FDA. A few presidents ago, was when the President Bush was in power. We visit hundreds of facilities each year collectively, me and my colleagues, subject matter experts, and we get to see a lot of opportunities and a lot of what we're going to be discussing here today, and of course, have been involved in helping companies with some of the issues that have happened historically, all of which are actually preventable, and that's a key point that I want to make today. So again, hygienic by design, reducing risk in your facility. I wanted to start with a few incidents that we've seen throughout the years, all of which have something in common. And it was that something in common was an issue regarding sanitary design. And as I said before, all of them could have been prevented. Back in 2007, we had ConAgra with a significant outbreak of salmonella, and that sickened about 625 people in 47 different states. It was a big hit to the company from a financial standpoint, about $78 million on that recall that they spent. I had the privilege of working with somebody who was at ConAgra at the time. He was part of the Acheson Group at some point, and some of you may know him, Randy Porter, and he said that it was actually a lot more than $78 million, close to $100 million. But, a company like ConAgra, you can say, well, for them, yeah, that's significant for any company, but it's not something that's going to put them out of business. However, they also had a huge impact to reputation, which is probably something that we cannot put a price to. Right? And just in 2007, they saw a decline in sales of 63% because of that. There was another case, which again, some of you may know as well. 2 years later, 2009, the Peanut Corporation of America. It was also a salmonella outbreak, salmonella typhimuriae in this case. What they manufactured and provided to many companies was peanut butter and peanut paste. 744 cases is the most update that I've seen, or data that I have seen in the FDA website or CDC website. 166 hospitalizations and 9 people died out of that contaminated product that was distributed. And that product was actually used, it was an ingredient that was used in many different products. I was actually leading the food safety and quality program here at Target Corporation in Minneapolis at the corporate level. And I remember it was a nightmare to, considering how many products were on just Target shelves that contain ingredients from this company. It is so far, I think, the largest or the most complex recall that we've had to do in the United States because of a situation like this. The company is no longer in business, but something particular about this one is that this was also a criminal investigation. It just didn't stay in, the company went out of business, recall done, retailers went crazy, of course, with everything that they had to do to bring those products back. But as I said, there was a criminal investigation that ensued as part of this. And famous photo with the FBI vehicle, the police vehicles in front of the company. Not very pleasant, I guess, for anybody who worked there, much less for the managers. But more important, there were a few things, and this is an abstract from Food Safety News from Bill Marler. And these are some of the things that the FDA found, according to the report that they produced. So there were a number of salmonella strains, of course, that were found in the facility. There were a few things that the FDA pointed out, some of which are actually related to sanitary design and the ability of the company to maintain sanitary conditions in that operation. And I have highlighted some of them there. I'm not going to read through them, but look at, plant is not constructed in such a manner as to allow ceilings to be kept in good repair or for food to be stored under conditions that would protect against microbial contamination. And then proper precautions to protect food and food contact surfaces from contamination with microbes cannot be taken because of deficiencies in plant construction and design. The outcome of this was that the superiors, that company, the people who led that company, went to jail. And in fact, I think a couple of weeks ago, I still saw an update on one of them who was trying to get out of jail sooner or something, and they kind of denied that. So the owner of the company was sentenced to 28 years in prison. The brother, who was also a broker and significant official of the company, was sentenced to 20 years, and the QA manager, she got 5 years in prison. So this is how significant this become, right? So it's not just consequences in terms of financial impact to the company and reputation and all that, but even to this level. 2 years later, because we still didn't learn enough with that one, so 2 years later, there was another case, this time involving whole melons, and that was Jensen Farms. This company is also not in business anymore, but in this case, it was Listeria monocytogenes, which is another one of those fear pathogens in food processing facilities. 147 cases, and even more people died in this case. 33 people died. Out of the FDA investigation, of course, there were a number of positive samples that came up. There were some deficiencies in terms of sanitary conditions of the environment, but one of them is related to us here: poor equipment design and lack of fit for purpose. The equipment that they use was not designed to handle the type of product that they were manufacturing and handling there. And because of that, of course, it wasn't cleanable, or not able to be properly cleaned, and therefore it led to a cross-contamination of those melons with Listeria monocytogenes. And like I said, the company could not survive that and also went out of business, okay? Again, in working with all these companies throughout the US and throughout the world, we always tell them, well, yesterday was them, today, who's that gonna be? And tomorrow, right? So with all of these being preventable, you definitely do not wanna be, or companies do not want to be the next ones that get highlighted in these types of negative news. So having said that, having set the stage for the potential consequences of not adhering to sanitary design, just wanted for us to be on the same page. What is food safety, right? So according to Codex, is the assurance that food will not cause harm to the consumer when it's prepared and eaten according to its intended use, right? And I want to quote something that somebody said out of part of the litigation that went on. He says, "I am the one asking you on behalf of myself, my family, and the 1,500 others who were sickened, please make our food system safe." Right? And many times when we hear this thing, it's just like, sounds kind of foreign, right? It's like, oh, well, that's not gonna happen to us. Our plan is super nice. It's, we're never gonna be there. But, depending on who you ask, right? And based on the consequences of some of these, you might be directly impacted at some point. And food safety always says, it's not a matter of when, it's not a matter of if, but it's a matter of when, right? So the best we can do is just be proactive and try to prevent situations like this. We know that, we're trying to prevent food safety hazards here from the risk of those, right? And those are biological, chemical, or physical agents that have the potential to cause an adverse health effect. It's also the definition of Codex. While we know these three types of hazards, and chemical ones are very relevant also to sanitary design of equipment, and even physical ones, I'm gonna focus mostly on the biological ones because we see a lot more cases from those. Some microbes, a lot of microbes actually are helpful. Most of them out there, they don't do anything. They're just hanging in there. They, fulfill their role in life. And many of them, actually, we use them to manufacture food, to produce food. The yeast that you use for bread and wine, the yogurt, the cheese that we make, all of them we use. They're nice, they're cool microbes. But there are some that are not as good, right? And we're looking at a couple of aspects here, quality and safety. So think about the spoilage. It's estimated that 30% of the world's food supply is lost to spoilage before it can be used for processing or consumed. And then aside from that, we have the ones that cause disease, the pathogens. Those are the ones that cause these 3 incidents that we look at the beginning. And where do they come from, right? There's different sources. There's the raw materials, the harvesting, the storage. That's before they get to the processing facility. But once they get to the processing facility, then, again, ingredients that may come in, maybe they're not pasteurized. The processing equipment, right? If it's not well designed and people have not been able to clean it properly, or they drifted somehow in that process. The personnel, of course, we have humans, and we're not perfect, and we make errors. And, so that can happen. And then distribution and storage can also be the source of those. And so what happens once they enter into the facility, right? Through any of those means that I just mentioned, they like to persist in niches. What do microbes need to survive? They need water, they need food. Some of them, they need temperature, right? And some of the things, oxygen and whatever. But they find, in most processing facilities, they find the perfect environment, haven. So why would they want to leave from there, right? They want to stay there. They want to survive. And they can also move through the facility. They're not just going to stay there stagnant. They can get moved. Some of them are actually motile, but more so via dust, via traffic of vehicles and employees, condensation. Never heard of condensation in food facilities? Happens a lot. They survive, and not only survive, many of them grow as well within the facilities. And in that way, they can become the sources of potential cross-contamination of food. And we have seen, there's multiple studies out there. Came across this one, little dated. What actually happens hasn't changed much. This is from the meat facility, and how the isolates from the environment relate to isolates that we can find in processing lines and the incidence of microbes in the processing line. And this was a case of Listeria monocytogenes. But we see that relationship in between what we find in the environment and what we can find in food, that it's there, at least directionally, from a risk perspective. And we can think of 2 different types of microbes. Some that are transient, right? First I have to say, a food processing facility is not an operating room. We're not in a sterile environment. This food processing is not pharma industry. So let's start from there. We're not looking for it to be a sterile environment, okay? But we do know, based on that some of them are gonna come through, right? Some of those could be some of those pathogens that make it through because of the ingredients, because of workers, because of everything that we said before. But our cleaning and sanitation programs and our ability to do so based on good design, for example, of the equipment and the facility, should be able to remove them on a regular basis. Let's say every 24 hours or every whatever frequency you have for your cleaning efforts. What we don't want is those who are going through, but then because of conditions in the facility, like to stay, right, and become then residents. Call those resident. We do a lot of work with Dr. Martin Whitman at Cornell, and he likes to call those pets, like pet listeria, for example. It's definitely a pet that you don't want to have. You don't want to have any pets in your facility, but that's one that you definitely don't want. And those are the ones that will stay, and we'll talk about biofilms and a few other things later, that will make it difficult for you to remove them, particularly if the sanitary design of that environment is not optimal, okay? Listeria, monocytogenes, salmonella are 2 of the most concerning ones. There are some others, as you see on the list, but those 2 are of primary importance. And there is some technical details here about these organisms. I'm not gonna go over all of them, but know that Listeria, it's commonly found in the soil. It's ubiquitous, okay? So it's not a contaminant that came from who knows where. It's actually in the environment all the time. So if you can think about, if you imagine that, then it's easy for us to track it, for example, into a facility, right? And to come from the farm, maybe with fruits and vegetables and other ingredients. So particular about this organism is that it likes cold and wet environments, okay? Many times we try to use low temperatures to control the growth of microorganisms. Listeria, I'm not gonna say that the growth rate is not reduced, but it's definitely not reduced as much as with other organisms. It still grows. It can grow in your fridge as well. All right. So having said that, well, where does it like to be? Well, in places where there is water, where it's cold, there's cracked, hard to clean areas, right? One thing that it likes to do is to form biofilms. And I think, yes, there's a next slide. It's about biofilms. Big problem. And not just a problem, it's a big problem, okay? It's a matrix that microorganisms form when they reach a certain level of population and there is enough debris from the operation, right? Like food and water and all of that. Once they reach a certain level of population, they actually talk to each other as a group. And they say, you know what? It's time to get some protection here from those sanitizers that they're using or that, that cleaning, those cleaning efforts. Why don't we do that? So they they form this, sometimes slimy, they don't always have to be slimy, but these structures that we call a biofilm. Those biofilms, eventually, they actually grow in size, and they also get destabilized with time because shear forces and some mechanical efforts that people put into it. And what happens then, it's parts of it can go into the flow of food and then cross-contaminate the food, okay? Normally, within that biofilm, you don't have just one organism, but you have multiple, right? Different organisms that do nothing, some others could be a pathogen, and so forth. Important about those biofilms is that they protect those organisms from the actions of sanitizers. So for example, if you think that by just applying a sanitizer, you're doing a good job, if you didn't clean well, that's not gonna happen because many sanitizers are susceptible to organic matter. And not only that, but also this structure protects them. It's like a physical structure that will protect them from the action of the sanitizer. So you have to do a good clean first. And obviously, you have to be able to do so. Just curiosity biofilm up close. So super magnified structure there where you see the organisms, the food debris, the matrix. There is a polymer that they secrete and helps give stability to that structure. Another one of these bacteria that we are concerned about in the environment is Salmonella. There's a lot of different serotypes of it. It does infect a lot of people in the US and throughout the world via foodborne pathogen. This one it survives well in the environment, particularly in dry conditions. It loves to be in dry conditions as well. And it can tolerate heat as well. In fact, when the conditions in the environment, the amount of water in that environment is low, then Salmonella likes to become more resistant to heat. And that's considered, and if we're processing food, particularly on the dry side of things like cereals and all of that, we know that. And we account for that from a process steps, right, perspective. But the organism likes to survive in that cleaning environment, and what happens is it will not grow, but it will hang in there. And when the conditions are right, like if you add a little water, or if that ingredient eventually becomes part of a food system that has a higher water activity, then it will proliferate. And remember, we saw some of those, both Listeria and Salmonella at the beginning. E. coli, just want to mention very briefly, pathogenic E. coli. Normally not one that we look at in the, as part of an environmental monitoring program. Mostly focus on in meat processing facilities, but it can also survive in low moisture foods. We found it in flour, for example, okay? In terms of survival ranking of these organisms, Salmonella is the most, kind of the strongest one, the more robust one, then followed by E. coli 157 and finally Listeria. Listeria is easy to kill and to get rid of if you do a good job cleaning. And we've had a number of challenges with Salmonella, well, with pathogens, but the case of Salmonella is the one that I want to highlight in low moisture food because of different issues regarding, how the organism behaves, how it can survive those dry environments. Because in dry environments, we don't have the luxury of using water many times. That's a challenge. And then, of course, we allow those niches to form where the organism can persist and hide in there. for a long time. Data is a little dated, but I do have a more recent one. I mean, some of this data you can't just get like the one from not even last year, like 2 years ago. But anyways, you can see how in terms of salmonella, we haven't really done a good job in reducing the number of infections. Okay, some of the others we have, just as we saw in the previous slide for E. coli 157, but with salmonella we keep having trouble. Impact of foodborne illness in the US is significant. 48 million people get sick every year. 128,000 are hospitalized, and out of those, 3,000 die. In the United States, 3,000 people die because of foodborne illness. E. coli 157, Salmonella, Listeria are part of the top 5 that cause all of that. From a financial standpoint, about $80 billion in cost, which I said was what? Preventable, remember? And not to mention the impact to reputation that we talk about. We also have the spoilage organisms, remember? Yeast, okay, and molds. Right, so let's not forget about those. And we have one last thing that I wanted to highlight in terms of hazards in the environment, allergens. Allergens are chemical hazards, not biological hazards, but they're equally serious. They can kill people, okay? And there is a part of the population, you may know somebody, or you might be one of them, who are susceptible to some of these, who are allergic to some of these proteins. And part of the challenges that we have with controlling allergens is improper cleaning due to water exclusion, particularly in dry facilities. Okay? So then what do we do then to control these hazards? We have an equation here, and I've seen different versions of this one. This is kind of a simplified version of it, but good manufacturing practices, sanitary design, and sanitation procedures are necessary for effective control of microbes and allergens in the environment, okay? If we're missing one of those, or if one of them is interfering with our ability, for example, sanitary design not allowing us to clean properly, then we're gonna have issues, okay? We have a high risk. And that leads us to the definition of sanitary design, right? So application of design techniques which allow a couple of things: timely and effective cleaning of the entire facility and equipment, the entire manufacturing asset, all right? Which one would you think you could do a better job of cleaning? I'm not about you, but I can do a lot better job of cleaning on the right side of that image, okay? Actually, I do have one of the other ones, but it takes a while to clean that properly, and even then, you still haven't done a perfect job. So what's the scope of sanitary design when we talk about that? It's both the facility and the equipment. I want to make that point clear. Sometimes when we talk about sanitary design, people focus entirely on the equipment, and they forget about the facility itself. I can have equipment that is, super aligned with principles of sanitary design, but then it's placed on a facility that it's hard to clean, that has the wrong materials, that has a lot of cracks on the floor, that is cramped, so there's a lot of equipment in terms of layout, not properly organized, and therefore I still have a lot of risk. When we think about scope, we should also think about the entire life cycle of the equipment and the facility. We shouldn't be thinking about, equipment is too expensive, upfront cost. No, we're gonna go to the cheaper version. It's really, you're looking at it, if you look at it that way, that's the wrong way. You have to look at it along the lines of the entire life cycle of it. And as we said before, we're looking to control what? Physical, chemical, and microbiological or biological hazards. So that's part of the scope as well. Not just microbes, remember the chemicals and the physical hazards. And I like this slide, and I missed the reference there. I believe it was contributed to me by somebody at EHIC. But hygienic design principles and integration, and the reason I wanted to show it is because it does support the idea of this being the entire manufacturing asset, not just the equipment, but facility and equipment, as you see there. And there is even some of the things that are, not really like material, like physical stuff, but like training and education, right? Remember we said that workers and personnel are part of the potential factors that can spread contamination throughout the facility. So that's part of hygienic design. Training them to understand, oh, okay, that's why this needs to be laid out in that way. That's why that equipment needs to be cleaned in this way. That's why when we decide to purchase equipment, it has to have these characteristics and have been aligned with these principles of design. We've learned a few things by not doing that, right? It's a funny picture that we like to share. So I have to clean this for the next 20 years. What were they thinking? What were they thinking in this case? Right? I'm going to have to be cleaning that regularly. How about that? Facility, see? Talking about their facility. Time and money spent on condensate control. And not only that, it's not just the time and money spent, but the risk. If for some reason you have exposed product or exposed food contact surfaces underneath there, and that condensation is dripping on top of it, that's a high risk. And now, be honest with you, there is no difference between your food contact surface and your food product and that ceiling. Same thing. You can't rule out that what you have there is what you have in that food too. And we see a lot of that as we go through facilities. Needless to say, sanitary design reduces plant operational cost. That is a great example of how we can save money and time. If that facility was properly designed and the airflow and humidity and other things were properly controlled, then that employee would not have to be spending time doing that. And therefore, there will be operational savings to that company. Okay, and this is a reference from the American Meat Institute, where they did a study, and they found that there are savings in terms of maintenance and labor associated with that facility. There is a little increase there in terms of utilities, but we can debate that too. Another slide that I got courtesy of EHEC at some point seems complex. Really what it says is, I understand that there is a certain level of microbes and dirt that if I go above that, my product is at risk of having quality issues and potentially safety issues as well, right? And the better the cleaning that I do, the more time that I can devote to use that production floor for processing. This is, it's not a nonprofit organization. It's an organization that needs to sell and needs to make money to survive and to grow. The better cleaning that I do, enabled by, among other things, good sanitary design, the more time I will be able to devote to production, which is what the company is made for, okay? And the opposite is also true. I'm not gonna go over the principles of sanitary design. You might have gone through those. In fact, you have some of those in your sheets that are over the tables. These are from the American Frozen Institute, okay? But there are, just like that, there is different principles that we can follow. They're not in conflict with each other. They're actually complementary. And just as they are the principles, there are ways to evaluate alignment with those. And here is one of multiple examples of checklists that are out there to verify alignment with those, right? From an equipment manufacturer's perspective, what is the responsibility? What's the expectation? Is that the basic elements for design and cleanability are fulfilled as specified where? Who dictates that? Well, regulatory requirements and third-party guidelines. Allowing for proper cleaning and sanitation enables safe food processing. And I had the chance to work for an equipment manufacturer, Bueller. Somewhat you may know about Bueller as well. And by the time that I left Bueller, we were pretty aligned, and I know that they're even better aligned with it today. So that's a success story, and I was happy to work there because of that. The guidelines, standards, and requirements, they're various, right? Some of that, like this organization, 3A sanitary standards. There's National Sanitation Foundation, the bakery industry has their own one. The Grocery Manufacturers Association, which is a consumer brands association now, they also have some very good publications out there and resources. The American Meat Institute, an initiative that was there for a while called One Voice, and so forth. In Europe, there is the European Hygienic Engineering and Design Group, EHEC, which I've mentioned now a number of times. And then there is also GFSI, the Global Food Safety Initiative. So why sanitary design? Where we're spending time here today and a couple more days. Well, customers that trust the food they consume, they do trust that the food that they consume, it's gonna be safe. It's not gonna have pathogens or other hazards, right? They have zero tolerance to that. We do. I don't know if you don't, but I do. Most people do. So employing sound sanitary design principles helps ensure that that expectation is achieved. So that's from a consumer perspective. But there's also regulatory expectations. USDA, the United States Department of Agriculture, which regulates 20% of our food supply, routinely performs reviews on equipment before it is installed in food processing facilities and during their plant inspections. There's the Food and Drug Administration, regulates 80% of our food supply. And they do say, part of 21 CFR 11740 says, equipment shall be designed of such material and workmanship to be adequately clean and shall be properly maintained. All right? And we have the Food Safety Modernization Act, the most significant update in 70 years to our food safety system, which was enacted a number of years ago now. And one of the pillars of FSMA is prevention. And remember I said at the beginning, all of those incidents that we talk about, they're preventable. And I know there's a presentation after this one from FDA, so I'm not gonna go into great detail about FSMA, but a couple of slides that I found a while ago in terms of how FDA views this is they expect that companies and manufacturers embrace sanitary design. They say equipment manufacturers have a responsibility with respect to cleaning and sanitation. And most importantly, sanitary design cannot be secondary to functionality of equipment. And they go beyond to say, to declare what their view is in terms of actions against violations. And it says if FDA determines that the equipment is not suitable for its intended use, it will go after manufacturers that use it. So obviously that's not good for businesses, either manufacturers or the users of that equipment. Besides regulatory and consumer expectations, there is also industry-driven initiatives, and we talk about GFSI, the Global Food Safety Initiative. And they have different standards, as you probably know, under the umbrella of GFSI certification programs, right? And those are required by major retail outlets out there. They do address food equipment design, construction, and maintenance. More details about that are available at their website, but I capture at least a couple of abstracts here from a couple of their certification programs. BRC, for example, there is the clause there, 4.6 equipment, and I can't remember what version this is. I think they're on version 9, but it is part of their expectation. And then there is FSSC 22000. They also capture that in their criteria for auditing and certification of companies. Again, why sanitary design? Last couple of slides here. It's essential to ensure food safety, as we've seen, okay? The ease and level of cleaning of that equipment and that facility are directly related to the potential for that food to get cross-contaminated with microorganisms or cross-contacted with allergens, okay? And other undesirable effects, negative effects on quality, as we saw. There's a graph there, was published at some point in the Food Safety magazine. And I like it because it says for you to achieve repeatable food safety results, there has to be a number of things. Train employees. Remember, we said we can be talking about all this here, but if employees are not properly trained, not gonna go probably very far. And obviously you have to validate and verify processes. We know that. But look at what's supporting it. GMPs, we talk about good manufacturing practices, sanitary design of equipment, sanitary design of facilities, and obviously a systematic way to ensure food safety, either HACCP or the risk-based preventive controls approach under FSMA, now from the FDA. And in addition to that, if you put all that in place, you will also be able to continuously improve your operations. So in summary, 2 key points, if you get anything out of this presentation. Consumers, regulations, industry standards, and best practices require that equipment and facilities be designed in a hygienic or sanitary manner so that they can be easily and thoroughly clean, okay? facilitating proper cleaning, right, which can be severely impacted negatively by equipment not being designed properly or the facility. But facilitating that cleaning and that sanitation allows for safe food processing and helps mitigate important risks for your operation and for public health. The risk of public health, but also operational, reputational, and regulatory risk, okay, for food processing facilities. So those are the key takeaways from this presentation.
Well, thank you so much. Today I wanted to talk about mainly two concepts that we believe there are a lot of opportunities for improvement in these areas for verification activities and corrective actions. And these are things that folks like myself and other folks in the center spend a lot of time working with companies on every day. So wanted to focus this talk on these two elements of prevention of foodborne illness. There are throughout this talk, I will talk about hygienic design and some of the things that we've seen when companies have gotten into trouble, some of the hygienic design elements that contributed to those, but we'll get to those as we go through. First, I just also wanted to say that the agency really appreciates the collaborative effort that 3A puts to develop sanitary design standards. We appreciate mainly the collaborative aspect of that to come out with sanitary standards that are good and will allow the development and engineering of cleanable equipment. And we know how important that is for food safety. It is a foundational element that is under FSMA, as the previous speaker said. So anyway, thank you for the continued effort, and we look forward to that collaborative effort going forward. So as I said, today I want to talk about verification and corrective actions. These are a few of the things that are going to be sprinkled throughout the talk. And when I first thought to put material together, I was going, okay, we'll go through these and we'll talk about product testing, we'll talk about environmental monitoring, kind of take them from top to bottom. But instead, what I'd like to do today is use a letter that we published and sent to industry a little over a month ago. This was a letter that was targeted to the powdered infant formula industry, and it was a result from a lot of the work that we have been doing over the last year and a half or so, inspecting facilities both here in the United States and overseas. We've inspected a lot of facilities that were involved in the manufacture of infant formula, as well as facilities that were manufacturing ingredients that were moving into infant formula. And as we went through and conducted these inspections, we started to reflect on the things that we were seeing in these facilities. There were some trends. There were some common opportunities that we observed across these facilities, and so we said, let's put a letter together and communicate those to industry. Now, this letter wasn't intended to be an exhaustive list of these are all the things that we've seen in these inspections. This was really intended to communicate what we saw were the top 5 opportunities that were widespread across multiple facilities. So what I'd like to do today is use this letter as a backdrop, a framework, if you will, for this talk. And I'll walk through the different areas that we presented in this letter and then expand upon that and talk about some of the other things we're seeing in other categories of food production that essentially have the same opportunities. Nothing in that letter is unique to powdered infant formula. And I would also say that not much in that letter is new. I mean, these are issues that we have talked about from a food safety management standpoint for many years. But yet these are opportunities that are contributing to food safety events that we're seeing in facilities. So I guess quick, how many people are familiar with this letter, have seen it, have read it? I know some of you are in the infant formula business out there, so if you haven't, don't just ignore it because you don't make infant formula. Like I said, these are concepts that are applicable across the board. So I encourage you to look this up. It's out there on our website. Quick Google search will get you there. In the letter, we do identify 5 areas of concern, and these are the 5 that we saw the most prevalent and the most concerning. Controlling water, although these weren't intended to be listed in terms of importance top to bottom, we did try to put the ones up top that we wanted people to pay more attention to. So we're going to talk a little bit about water in dry production areas. We're going to talk about environmental monitoring and verifying the effectiveness of preventive controls using environmental monitoring. We're going to talk about corrective actions, and this is probably the biggest section where we see a lot of different opportunities, and we'll talk about corrective actions in a couple different ways. Supply chain controls, and then the end section about biological hazards. So for the remainder of these slides, if there is a statement in black, it's something that I essentially have copy and pasted right out of the letter. If there's stuff in blue, which there will be, then it's not in the letter, it's something that I've added in there. So let's get started with water. You know, like I said, this isn't a new concept. We have talked about controlling water in dry production areas for decades. The war on water. You know, we know that reducing the presence of water in dry production environments when you're making a low moisture product is essential for controlling food safety. Unfortunately, as we looked at facilities that manufactured powdered infant formula, we found a lot of water. We found an unexpectedly high rate of water within the production environment. So where are these waters coming from? Well, if we went out and we made a list, I think we could say all of the above. We saw water that was attributable to sanitation. So in some of the facilities, as we went in to powdered infant formula facilities, we observed sanitation practices that were not only being conducted very frequently, you know, so we were a little bit shocked with the frequency in some facilities at how many times they were conducting CIP. But then that water was able to escape through leaks. So we're introducing a lot of water into the equipment to clean it, but we weren't controlling that water into the equipment, and that water was escaping into the production environment. Also related to CIP, we're introducing a lot of water into the equipment. After we're done with sanitation procedures, the last step is we have to get that equipment dry. And one of the things that we observed in some of the powdered infant formula facilities was they did not have data to support that their procedures were effective at actually getting the equipment dry. And we had observations in some that it wasn't getting dry. So that was observations of water related to sanitation. We also saw leaks from outside the facility, and you know, you can take the usual suspects, roof leaks, you know, leaks from walls, any of the exterior water that is able to penetrate the facility and enter into the production area. Unfortunately, we saw observations of those as well. One of the striking things as we talk to manufacturers and we talk about water, you know, a lot of them would say things like, oh, you know, I mean, water is a rare event in this facility. You know, we just don't have water in our dry production environment. And one of those factories that we inspected, we were there for 5 days. We saw 3 different water events on 3 different days. But water is a rare event in the dry production area. So then we ask, well, do you have records? You know, when you see water, you have observations of water, do you keep records of, you know, where is this water coming from so you can trend it, track it, you know, see what are the repeat observations of water? Well, no, we don't have any records of that. So just from an overall management of water, you know, this is something that we absolutely want to re-communicate, is that, you know, controlling water is absolutely essential in here. And certainly uncontrolled water in equipment in dry production areas has been a contributing factor to foodborne outbreaks. It's not just limited to powdered infant formula. You know, we also, in the last year and a half, there has been a major outbreak associated with another low moisture food. And one of the contributing factors in that was also the infiltration of water from the outside of the facility into equipment. And in that case, the equipment was designed properly, but it was installed incorrectly. And in that case, water was able to infiltrate the ready-to-eat section of the process through equipment, cooling duct that was installed improperly, and it was allowing unfiltered air and water from the exterior directly into the food contact surfaces of the ready-to-eat product. So again, the equipment was designed right, but sanitary design also includes installation. And in that case, that was the contributing factor in that one, or one of. Environmental monitoring. So environmental monitoring is certainly an important verification measure. It's used to verify sanitation, hygienic controls, that they are effectively preventing pathogens from entering the environment or persisting in the production area. When we talk about environmental monitoring, of course, we can monitor directly for the pathogen, or we can monitor for an appropriate indicator organism. And we'll spend a little bit of time on this as we go through this in the next slide. What we observed when we were looking at infant formula manufacturers was that a lot of the firms were limiting the collection of samples for Cronobacter to really the areas tightly around the product zone. And they were relying on Enterobacteriaceae testing in what might be considered zone 3 surfaces throughout the production area. And some firms weren't doing very much, if at all, Cronobacter testing in that part of the production area. However, when we're talking specifically about Cronobacter, we have concerns. We're not aware that there's enough data demonstrating a correlation between Enterobacteriaceae and the presence of Cronobacter. And in fact, when we went in and we did environmental monitoring in these facilities, the typical way to use Enterobacteriaceae is you baseline it, and you're looking for levels, and you're looking for spikes. And when you see a spike, it may indicate something like a water event happened or some other breakdown in a hygienic control allowed Enterobacteriaceae levels to increase over their baseline. What we're finding is Cronobacter, being that it is a ubiquitous microorganism, is present in these without spikes in Enterobacteriaceae. So relying on just EB testing as a measure of, or to answer the question, are my hygienic controls working to prevent something like Cronobacter, we see that as a challenge in some of these environments. So I also want to spend a few minutes and talk about Listeria, one of those other environmental pathogens. So in this case, Listeria species, testing for Listeria is considered an appropriate indicator for Listeria monocytogenes. And over the years, industry asked FDA to consider a different policy in regards to testing food contact surfaces for Listeria. In the past, FDA would look at a Listeria species positive on a food contact surface as equivalent to Listeria monocytogenes. Back in 2017, we released this draft guidance, and it is still in draft today. And part of this guidance addresses the ability to test for Listeria species without immediate action on the product. We've been hearing recently from industry that there is an increased effort to look at food contact surface testing and to do more food contact surface testing, and we absolutely agree. The quote that I put up here is from a paper that was published around different policy or different approaches to controlling Listeria monocytogenes, and certainly looking at food contact surfaces is an effective approach at reducing the risk associated with Listeria. So I don't intend to go into all of the corrective action chart. I simply put this up here as an illustration. If you're not familiar with this, please take a look. This is our guidance, and this is our current approach. If a firm is testing Listeria species on a food contact surface, these corrective actions allow the firm to take corrective actions, address the contamination without immediate impact on product. Now, our observations, unfortunately, is that most companies are not testing food contact surfaces for Listeria. So I won't ask for a show of hands, but as we talk to industry and we ask those questions, well, we gave this in guidance. Why is it not being implemented? And I ask that same question to you today. I've gotten different answers, but it is a challenge. This is something that industry asked for. This is something that FDA has provided. And we know that testing food contact surfaces is a very effective means for evaluating your controls and reducing risk. So I strongly encourage you to take another look at this guidance document and look at your programs for possibilities for implementing food contact surface testing. Okay, corrective actions. So there's a couple different aspects of corrective actions that I want to talk about. And the first one is the concept of a root cause investigation and root cause analysis. And certainly effective corrective action plans, they involve conducting a root cause investigation. This is how we investigate what happened, how much product do we need to put on hold, what are the areas that were affected by a finding, how do we mitigate the finding. I threw some definitions up here, and these are definitions that are more pulled out of some of our regulatory looks at root cause investigation and root cause analysis. But the root cause investigation essentially is looking at, what happened, when did it happen? Can I gather information that tells me, what happened, what may have led to this contamination event? When did this contamination event happen? On the root cause analysis side, you're really looking at how and why did this happen. So we can develop essentially effective preventive actions to avoid it happening again. So is an RCA required? Are you required to conduct a root cause analysis? Well, the short answer is no. And this is language that came out of the preamble to the preventive control rule, where that question was asked. And no, the rule does not use the term root cause. But it does require a facility to take appropriate action to reduce the likelihood that a problem will recur. And so root cause analysis is simply part of a common approach towards understanding what happened so that you can take appropriate action to prevent it from occurring again. A root cause investigation is one thing. When do we think a root cause analysis is warranted? Well, highly encouraged if you're finding pathogen in your product or you're finding a pathogen on a food contact surface, then you might want to consider a root cause analysis. I would say that as we work with firms, and these are firms that either we have been doing an investigation, an inspection, and we start finding that the firm has had positives in product or in their environment, our question is typically, what did you do about it? And when we are working with firms that don't have strong understanding of root cause, then we question whether they have done enough to really prevent this problem from happening again. So although it's not explicitly required in there, I would say that in terms of being able to interact with our agency as we're asking questions about, well, okay, you had a positive in product, how did it get there? What did you do about it? And the firm hasn't done a robust root cause investigation, or they've done one, but they aren't really sure, there's not a lot of confidence in it, then that certainly is going to raise suspicions around whether enough has been done to prevent that problem from happening again. So environmental monitoring. So as part of root cause investigation, environmental monitoring is one of those tools that's used, whether you're reacting to a finding in the environment or a finding in product, going out and pulling samples, seeing if you can figure out, okay, where did this contamination come from? Do I have it contained properly? Environmental monitoring is a common tool that's used in that. And when we were looking at powdered infant formula manufacturers, we reviewed and observed corrective actions that were taken in response to finding Chronobacter in either the environment or product. Some of these facilities, their root cause investigations involved taking equipment apart, investigating surfaces within the equipment, testing those for indicator organism populations. Some of the other facilities would run out and they had, okay, we found Chronobacter on an equipment surface, and they would immediately initiate sanitation activities on that surface. All right? And then after they did sanitation, they would collect samples from these surfaces to verify whether or not those actions were effective. So let's back up just a little bit. So let's start with the first one there, facilities that disassembled certain equipment. So in some of these cases, a root cause investigation would sound something like this. Well, we had Chronobacter in product. We went in and we looked at some of this equipment, we disassembled part of it, and we found a location within the equipment that was dirty. Okay? And we took swabs. We tested it for APC, we tested it for EB, and we found, some population of aerobic, plate count. So we think that's the root cause. Really? Why would you not test that surface directly for Chronobacter? If you're finding an unclean surface within a piece of equipment, certainly then there was a breakdown of sanitation if that wasn't cleaned properly to begin with and you started with dirty equipment. But what does that APC result or EB tell you? Is that a smoking gun? If you're investigating how did Chronobacter get into my product, and Chronobacter is an extremely difficult organism to root cause, you have a surface that you found that is showing signs of soil and potentially improper sanitation, or at least inadequate sanitation. Why would you not test it directly for Chronobacter? Increase your confidence whether you found the smoking gun or not. And this is one of the challenges as we work with a firm. They say, well, yeah, we found it. We found the unclean equipment. Well, did you? I don't know. Those questions get louder when, the firm continues to have problems. Did you really find the issue or didn't you? So an encouragement as you go out and you investigate, whether you're talking about Chronobacter, Listeria, Salmonella, whatever, as you do a root cause investigation, don't just limit to looking for indicator populations. You're already looking for an organism. Find the smoking gun if you have that opportunity. The second one here, facilities that immediately initiated sanitation activities. So again, if you run out and you start cleaning and sanitizing first without collecting any samples, you've now potentially destroyed any evidence that may have been there to figure out how Chronobacter in this case, or Listeria in other cases, may have gotten to that surface. So we're also encouraging firms to go out and pull samples before conducting sanitation activities and then go into the cleaning and sanitation. And then certainly there's going to be a round of environmental monitoring afterwards to confirm that it was done appropriately. So when conducting a root cause investigation, you can certainly obtain more confidence by looking for the pathogen. And that is always going to be a question that we're asking when we're evaluating the confidence within your root cause investigation. Sanitation breaks. So this is a very, very interesting conversation. And as we went out and we looked at powdered infant formula facilities, and certainly ones that had had issues with product, Chronobacter in product, these are systems like a lot of low moisture foods. There are a lot of production lots manufactured in sequence on the same equipment. There's not going to be intervening sanitation breaks between lots. This is very common across low moisture food. We put some statements in here into the letter, and again, remember this is, these are black, so this is pulled directly out of the letter. The best current available science demonstrates that the only adequate remediation for food contact surfaces contaminated by a pathogen is the application of a sanitizing treatment. And that being a chemical treatment, a thermal treatment, something else that is deemed appropriate and valid for killing the pathogen. Now, we also said, to date, other remediation procedures such as physical dry cleaning have not proven effective against eliminating pathogens from equipment surfaces. Now, this has been one of the aspects of the letter that we've heard back from industry on. There's been a lot of questions around this. The first question, well, is FDA saying that you have to wet sanitize? No. We're not saying you have to wet sanitize. In fact, that would be a little bit in conflict with the section that we started with on controlling water. What we're saying is we're questioning if you're using something else, and some firms use other approaches to dealing with mitigating contamination when they have an issue in their product stream. So we question whether or not the actions that firms have taken are adequate to remove the contamination, one, from the process, and two, from the food contact surfaces. What we see a lot of is, well, okay, we had, in this case, a Chronobacter hit, but you could replace that for other product categories. I had a Salmonella hit in finished product. And then, I did some testing on, product that I produced afterwards, whether it's a whole lot of samples or a little samples. Either way, I wasn't able to detect it anymore. So see, the pathogen went through the system. Okay. Is finished product testing in this case a validation that you've eliminated a contaminant from your system? I'm seeing some head shake no. We agree, it's not. So when we look at product testing, and this isn't limited to some of the infant formula firms that we've been working with, this is true for other firms as well, that the use of verification testing at the end and not being able to detect a pathogen doesn't mean that you've successfully eliminated a contaminant from the system. So this is something that outside of powdered infant formula in the last year and a half, we've seen other low moisture foods where companies use this type of approach, and they said, well, we ran so much product through the system, we did some intensified testing, we increased the number of samples that we collected from a period of time, and it wasn't detectable. So see, the contamination moved through the system. That approach resulted in one of the major outbreaks that we saw in low moisture foods recently. That company wasn't able to detect, in that case, Salmonella in their product anymore, but they were putting product that was contaminated with Salmonella into the marketplace. So again, what is the right approach? What is the valid approach? We're not saying that you have to do wet sanitation, but what is a scientifically valid approach when you have a contamination event, you now have a contaminant into your system, you've detected it in finished product, what validation do you have around your procedures that are happening on the equipment? The testing is verification of whatever's happening inside that equipment at the back end. It's not the validation itself. So I challenge, if you make or you work with systems that are making low moisture foods. You're making many lots without an intervening sanitation break. I challenge you to go back and think about your process. What would you do if you found a product positive? How would you know where to draw the line? If it's not sanitation break to sanitation break and you think you have an approach to lessen that, what is your scientific validation that that approach is appropriate? You know, we are certainly willing to evaluate scientific data when it's presented to us that are our other approaches. The reason why we put this in here, to date, other remediation procedures have not proven effective, is that nobody has presented scientific data that shows that it would be effective. So it's a challenge. Issue a challenge this morning. Okay, whole genome sequence. Still in the corrective action. Who here uses whole genome sequencing? Oh, thank you, thank you. You know, it used to be whole genome sequencing was cost prohibitive. Whole genome sequencing was limited to very few laboratories. There wasn't a whole lot of people around that had enough knowledge in this space to interpret the results. That's changed, and it's changed very quickly, and it's changed very fast. Today, there's a number of commercial labs out there that have wonderful systems. They can do whole genome sequencing, they can interpret results, they can do it, you know, with as much confidence as we do in our public health laboratories. This is no longer cost prohibitive. When I was in industry and I used to talk to our leadership, I used to say, you know, all of these things on the public health side of things when it comes to whole genome sequencing, they're getting really good at finding issues, really good at connecting the dots between illnesses, really good at doing the epidemiological investigations to connect circumstances that are related to each other. So the margin for error, I used to say this to, you know, when we did training for our executives, the margin for error on the industry side is getting smaller and smaller and smaller. So if you look at that in a pendulum, you know, what is the industry doing? What could be done on the industry side to even that out? Well, now whole genome sequencing is one of those things that is available more to folks in industry on a cost non-prohibitive basis. When we go out and we look at firms when doing investigations and following up on pathogen findings in the environment or in product, and one of the things that we're talking to firms about, and you'll hear this being said more and more, that we're recommending the use of whole genome sequencing to analyze and investigate any pathogen isolated from your production environment or product. One of the things that we often hear from industry, from different companies is, well, you know, I get it confirmed down to a pathogen, but I don't speciate. I just stop there, okay? Or I get it down, you know, I have the isolate, and I freeze the isolate. You know, if there's ever a reason why I might need to, then I've always got the isolate there. And I can go back to it. I'll do the analysis then, right? Or we hear things like, yeah, you know, I'm still using older technology and that's good enough for me. It gives me enough discrimination, it gives me enough information to do what I need to from a corrective action standpoint. So one of the things that we're talking to firms about is think about using whole genome sequencing as part of your routine corrective actions. You find an environmental isolate, you find something in your product, you're going to go down, you're going to confirm it, you're going to start taking corrective actions. You should be doing that on a presumptive. Why stop there? How much better could your corrective actions be if you went ahead and used the best available technology to investigate that isolate, to understand more where it may have come from, to really know whether it connects to other findings in your facility or not, whether it connects to findings outside of your facility or not. How does that change your ability to conduct corrective actions? I have down here on the bottom, recent outbreaks continue to demonstrate that if firms were routinely using whole genome sequencing as part of their corrective actions, they could have prevented both illnesses and deaths. And I'll give you two different examples. The first, a short shelf life product, no finished product testing, products on the market, on the shelf within days. Company involved in a Listeria monocytogenes outbreak, cases over a number of years, right? It's what we call a slow developing outbreak. Contamination consistent over time. In this case, it had manifested in equipment. There was harborage within a piece of equipment that was ultimately found to contain Listeria monocytogenes. So this company had been producing product over a long period of time, low levels of contamination, illnesses stretched over a number of years. This was a company that had the approach of, well, if we find Listeria monocytogenes or other Listeria in the environment, we'll freeze it. We'll look at it later if there's a reason. Well, there became a reason. When the EPI and the public health system caught up and identified them, there was a reason. They went back and they looked at their culture collection, and they found that they had the outbreak strain months ago in their facility. If they had taken action at that time, in this outbreak, 3 people died. If they had taken action when they had the outbreak strain in their facility, they could have known that it was them that was contributing to those illnesses. They could have prevented 2 of the 3 deaths and a third of the illnesses associated with that outbreak. That is a preventive use of whole genome sequencing in a manner consistent with corrective actions that firm could have taken to prevent illnesses and, by the way, reduce their overall liability. Another example, firm had a contamination event, low moisture product. This one, long shelf, it's a shelf stable, ready to eat product. They had a contamination event. They started finding salmonella in their product. They had a series of findings in their product over the course of a couple weeks, more like maybe a month and a half. From the first finding in their product to when the problem started to get so big that they were having multiple hits in their product, you could start to see the cases coming in from the public health system. In this case, if you used whole genome sequencing up front and you looked in the database, initially they would have saw nothing. They'd say, well, look at that. We had salmonella in our product, but no cases. That's good. Take corrective action. How confident are they in their corrective action? If they were monitoring the database for when things come in, which is a very easy thing to do, they would have started to see, we're continuing to have issues. We're not really confident in our corrective actions. And we're starting to see cases on the clinical side pick up. They weren't doing that. And unfortunately, a lot of people got sick. And that ultimately led to an outbreak and recall of their product. But they could have been prevented. They could have prevented a massive portion of that outbreak. So again, these are opportunities where you could use whole genome sequencing as part of your corrective actions and be in a true preventive mindset. Another area switching from corrective actions into supply chain controls. So as we looked at powdered infant formula facilities, certainly there are facilities that are involved in making products where they're using ingredients in a manner that a kill step isn't applied. Think of a dry blending operation, where you're dry blending ingredients into a product. This isn't a concept limited to infant formula again. I mean, these are things that happen in a lot of different manufacturing environments. So in these cases, what's going on at your supplier is very important to your level of control for whether it's Salmonella or Cronobacter. What we observed at some of the infant formula manufacturers was that the supply chain programs that they had developed and implemented weren't always characterizing the risk appropriately at their ingredient suppliers. Whether or not they were understanding what controls are implemented at the supplier level or how well the supplier was actually maintaining control, we found examples of both. One of the things that we put in the letter is this statement that is a fairly strong statement. But we think this is the mindset when it comes to supply chain controls for ingredients that are used in this manner. We said suppliers of raw materials or other ingredients that won't receive a lethal treatment, in this case at powdered infant formula, are an extension of the infant formula manufacturing process, particularly when it comes to sanitation controls and maintaining production environments and conditions suitable for producing infant formula. This is a strong statement, but it's intended to convey the message that these ingredients microbiologically aren't going to get any better when it comes to Salmonella or Cronobacter from the moment they leave the supplier to the moment that they're used in a powdered infant formula. And the same statement could be true for any other ready-to-eat product that's using an ingredient in this way. So the challenge is, okay, how do you work with your suppliers? How do you ensure that they not only have identified the hazards, but they're implementing the right programs? If we're looking at preventive controls, and you're talking about a hazard that is our lovely Sakota. So if it's a hazard that causes serious adverse health conditions or death in humans, think Salmonella, Cronobacter, these would be examples, Listeria monocytogenes, then you're required to have a supply chain applied control for those, unless of course you have a determination within your food safety plan that identifies other verification activities that could suit the purpose. Now, what is the purpose of the on-site audit? The purpose of the on-site audit is to afford you the opportunity to go to that supplier and, one, make sure that if you think Salmonella is a problem in that ingredient, that they also identify Salmonella as a problem in that ingredient, that supplier has identified appropriate controls that are valid, they're adequate to control Salmonella in the ingredient, and that they've consistently implemented those controls. What we've tended to see in a couple different examples of companies that have had outbreaks is they were saying, well, yeah, I have a third-party audit, I have a GFSI audit. Okay. As we've looked at those GFSI audits, and one of the examples of a ready-to-eat product that caused an outbreak of Salmonella, yes, they had a GFSI audit of their supplier. That GFSI audit covered a different product and process at that supplier. The product and processing line that the ingredient came from was never evaluated by the third-party audit. So yes, they had a third-party audit from the supplier, but they missed the point. They missed the point to really review and make sure if you're going to subcontract essentially that on-site audit out to a third party and say, well, I'm going to accept a GFSI, you better read what that audit covered. You better read and make sure that that audit covered your ingredients, the processing area where your ingredient is being manufactured, and it covered the controls for the hazard that you're talking about that supplier controlling. Just simply having a GFSI certificate is not enough. Okay, which brings us to the last section of the letter. And this one, the purpose that we put this section into the letter was really, as we're talking about powdered infant formula, we just spent the last year and a half talking extensively about Cronobacter. But the agency has continued to receive complaints about Salmonella and Clostridium botulinum, potential infant botulism. And we followed up on those as well, just as we have the Cronobacter ones. But we wanted to send the message to the industry that, yes, pay a lot of attention to Cronobacter, but do not forget about other hazards that are relevant for powdered infant formula and end up having a problem with one of those as a result of focusing so much on Cronobacter. But there's another aspect of this that I wanted to add into this talk. And as I've been spending time going to different conferences and talking to different segments of the industry, I've heard a couple things mentioned, whether it's been by folks in academia, folks in regulatory agencies, or folks that work out in industry. And this is when it comes to the concept of risk. And this is particularly troubling to me when I hear people say things like, well, what is the risk? I'm trying to assess, is the growth and toxin production of Clostridium botulinum within a certain, environmental condition, is this a risk? And when I listened to people evaluating that example, the question was, well, how many cases of botulism do we have a year that that are attributable to this? Well, none? Oh, see, it's not a risk. And off they went. And unfortunately, I've heard the same thing in conversations around Listeria and Salmonella, where people are very quick to say, well, how many outbreaks has it caused? None? It's not a risk. And I challenge that, because that's not where you stop. That may be where you start. And what is in here in the blue is basically a cut and paste from our Chapter 2 of the Preventive Control for Human Foods guidance document. And yes, certainly information from previous outbreaks, recalls, that's a good place to start. And certainly if there's a history, then that's informative of risk within whatever situation you're analyzing. But you also have to look at other information. You also have to look at scientific information. Is the hazard going to be reasonably likely to be there? There may be a whole lot of literature on, in this case, if we're talking about the Clostridium botulinum example, you might ask, well, in this case, is there spores really expected to be present? And the answer is unequivocally in that case, yes. Extremely well documented. It's going to be there. So then you might move to what are the conditions in which growth and toxin might form? Are they present? Well, in that case, yes. The simple fact that it hasn't hurt somebody yet doesn't mean that it's not a risk that needs to be considered and evaluated. So I challenge just a note as you're looking at your own food safety programs and you're doing your risk assessment, your hazard analysis, not to stop with just looking at what has caused a problem in the past, but really evaluating what's the potential for something to happen, what's the likelihood, and taking a preventive mindset from that standpoint.